Guys, thanks for joining us again. Welcome to Didactics. I'm Jake Goliver. I'm one of your APDs. This is my dad, Chris Goliver, owner and CEO of Riverwood, as well as one of our lecturers, guest lecturers today. So appreciate your attention that we're going to give to this. We're going to talk today about stress, team building, as well as just work-life environment and work-life balance. So let's see what Doc Goliver has for us.
All right. Well, I appreciate it, Jake.
Yeah.
You got to live both sides. You got to live it growing up, and now you're getting to see it from the other side of actually working in the trenches. So this is an interesting lecture. It was one that I developed when I did my Holmes Raw scale, and I came up with a score of nearly 400, which is not a good number to have.
I was going to say, when I did that lecture for you, 400 meant 100% chance of cardiac failure in 10 years or something, right?
Well, and I have an LAD lesion now, so still haven't done anything about it, but the 64 slice CT scan said, hey, you're starting to get some plaque development in your LAD. So it was a good opportunity for me to really look at, okay, what is stress? How does it affect the body? And what can I do about it? This is something that affects everyone. There's no one out there that doesn't have stress. There's good stress, bad stress. So when we talk about stress, and I have a few definitions here, stress is a physiologic reaction to an event. It's the total mental, physical, and hormonal reactions of an individual to one or more demands. Some examples of stress: physical exercise, life-threatening situations, arguments, challenging assignments, getting ready for your boards, having a confrontation with a service, trying to balance work-life issues. And it's your perception to the event, not the event itself. As a firefighter, you would have citizens that would look at you when smoke would be blowing out of every window and the door, and they'd be like, oh my gosh, how can you do this? And as a firefighter, it's like, this is great, this is what we're here for. The team goes in, we're going to put the wet stuff on the red stuff, we're going to have fun. In emergency medicine, imagine someone comes in who is septic, blood pressure's in the 60s, heart rate's in the 130s, take somebody off the street and confront them with that. And oh my gosh, they don't even know where to begin. But yet with us, because of our training and background, hopefully it's like, okay, this is what we're here for. This is what we do. We'll take this to another level. Put me with a musical instrument in front of a crowd. I will vapor lock. I can't imagine. But yet you take a classically trained artist, and that's what they thrive on. So it's your reaction to the event. It's not the event itself. Once you start understanding that, then it's like, okay, what can I do to help that stress level, to get that back in check? And there are a couple of things here. Some of the things to recognize as far as the physical reactions to stress. You get, with the fight or flight, you get an increase in glucose, an increase in oxygen, your breathing increases, your heart rate increases, your blood pressure goes up, you get that adrenaline release, elevated hormone levels, and that's what allows the body to prepare for the fight or flight.
Now, a lot of those sound kind of like neutral. I think a lot of people think of stress as just bad, but there are good things that cause stress just as equal to bad things that cause stress, right?
Oh, absolutely. Look at the Olympics that are going to be upcoming here very shortly. There's actually a psychology with sports medicine that imagining yourself or a golfer, we'll say as an example, that they see the shot, they get themselves where they are seeing everything through, and they build up a certain stress level. The 100-meter dash, that person entering the blocks, or the weightlifter. You look at the weightlifters, that they're screaming and just pumping their body up in order to perform at a higher level. Now, in the emergency room, it's probably not appropriate to be yelling and screaming, getting ready to go in and intubate someone. But when all of a sudden it kicks up to another gear, it allows you to function at a higher level.
Okay, yeah.
So the general adaptation syndrome for stress, you have the alarm. That's when the body's alerted to there's a challenge in front of it, and it's mobilizing its resources. You're getting that glucose release, your respiratory rate's going up, you're getting increased oxygen intake, heart rate's going up, delivering blood through the body. So it's the alarm phase. You get the resistance. The body battles that source of the stress with the aid of that extra energy. And then you get into exhaustion. where the body's reserves are used up and it can no longer battle that stressor effectively. That is where you get into when you were talking about with the score of 400, that this can be very bad for the body. So what can I do to help so that I'm not one of those statistics?
Yeah, and that exhaustion phase sounds kind of like synonymous with now modern day terms, burnout.
Absolutely. So how do I stay on my game? How do I put things in perspective? As you talked earlier, helpful and harmful stress. Remember, it's the perception of the task and not the task itself. If you have somebody who is just starting as an intern and you ask them to go put a central line in or to go intubate someone or to put a chest tube in, I'm sure their stress level is going to go up. I shouldn't say I'm sure. I'm guessing their stress level is going to go up much higher than the third-year resident or the seasoned attending who has perhaps done as many as 2,000 intubations.
Yeah.
And it's like, okay, I've got another intubation. Okay, here we go. So again, it's not the task, it's your perception to it. So how do you get that perception that it's like, okay, I've got this? The golfer, that they have 190 yards in, water in front, bunkers on both sides, and they see a 5-foot circle. Whereas the average golfer is like, oh my gosh, all I see is water and sand. So it's your perception to it. The results of excessive stress, it has a series of effects on people. The 4 major effects include behavior, addictive, additive, and cumulative. So when we talk about behavior, reactions to a stressor do not automatically terminate when the source of the stress is removed. After you get done running a code situation, or you're in a high stress environment where you've got a small child who is incredibly sick and needs to be in the PICU, just because you finally have the child out of the ED and heading up to the PICU doesn't mean that the alarm response to the body just instantly goes away. It's still there. It's still kicked in. It doesn't turn off that quickly. The stress-induced behavior can be present even after the stressor disappears. So you can become angry over an unrelated event. You have a bad day at work. You come home, and all of a sudden, just the littlest thing sets you off. Again, it wasn't that task. It wasn't that event. It was your perception to it.
Yeah.
And when you start understanding that, oh my gosh, this stressor here is affecting me, and I'm taking this home, or vice versa. You get in an argument with your significant other, and it's a heated argument, and come into work.
It's a bad day at work, regardless of what happens.
It's a bad day at work. It goes both ways. Sometimes we use a behavior as an attempt to ventilate stress. We use jargon to dehumanize our victims. We use stereotypes or profanity to make the event seem less important, or the use of sick humor. When I started residency, the term there, kind of dating myself, was, oh, it's a Gomer. Having practiced emergency medicine for several years now, I look at that, you're right, that's a grand old member of my emergency room. That person coming from the nursing home, that was somebody's son or daughter, perhaps brother or sister, a mother or father. That was a human being, and they have some of the most interesting stories if you have the opportunity to get to talk to them. We're losing the greatest generation. We're losing those people who have went through World War II and some of the stuff that they encountered. And if you get the opportunity to actually get to talk to them a little bit, it's amazing the warmth that you feel inside. It's not just, oh, it's another dump from a nursing home. So again, it's a perception thing of how do I change that perception of going in for another altered mental status from the nursing home to I'm going into someone's mother or father or their grandmother or grandfather, and what would I want if that were my parents or my grandparents? And grandpa now, I'm in that role. Yeah. I'm hoping that if I come into your ER, you don't look at me as just, oh my gosh, it's another nursing home dump.
If you showed up at my ER, maybe.
So we start talking about addictive stress. The stress reaction, it creates a physiologic high. You get your increase in adrenaline, blood sugar, heart rate, blood pressure. When your daily reality of the profession gets that stress level up there that it's addictive, that becomes what's normal. This is what prompted me to start this entire lecture series, because Barb and I would go down to the Dominican for vacation in the wintertime, and she would have a book, be sitting there looking at the ocean, watching the waves, listening to the air, and just relaxing. I would open my book, read about 3 sentences, go, wow, this is so boring, go down to the cabana, bribe them $20 to allow me to take a sailboat out in red flag territories, only to flip the sailboat when I got about a half mile offshore. And then Barb laughing and joking, going, it's got to be Chris, because the guys are jumping up and down, running up and down the beach, yelling and screaming. Don't see a sail out there, because I managed to flip the sailboat. I had no regard for, to me, I didn't feel alive unless I was pushing the boundaries. Mm. And that was true in many aspects of my life. To riding a motorcycle, pushing it to the edge.
I remember the quote that got your motorcycle sold.
Yeah, we won't go by real fast. We won't go there. We aren't being taped. They go by really fast. We'll just leave it at that. So yeah, they go by really fast. That bike was for sale the very next day. But you become accustomed to such a high stress level that when all of a sudden you don't have something that's pushing those boundaries, that's pushing those limits, you feel bored. Mm-hmm. And that was the beginning of a wake-up call for myself, that there is some peace and tranquility in watching nature. Mm-hmm. One of the latest things that Barb and I just got to watch, and it was great, we had a hummingbird nest right outside our sunroom. Yeah. And we sat and we watched this mother hummingbird build the nest. We watched the babies grow up. And every day we were out there documenting and just watching them. And it was so peaceful. If you would have taken me back 15 years ago, 10 seconds into it, I would have been bored out of my mind. Mm-hmm. And now I can sit back and look at the awe with Mother Nature and carry some of that over, not just in my personal relationships, but also at work. Yeah. Because it's addictive. It carries over with you. You carry this with you.
Yeah. I think a lot of the language that we would hear as residents kind of talking about, I need this stress, I need this addiction profile, not addiction profile, but I need a better stress environment to be in is, gosh, it's been a long time since I've had a good code or a good trauma or something like that. I feel like that's the language that the residents in particular would hear coming out of themselves when they're getting adapted to that certain stress level. And you need something to push yourself. That's when it's like, okay, you need to be concerned from a resident standpoint of, every now and then, we do get academically bored. But I think that's what's been going through my head as we've been talking, is that's the language I feel like I have heard from residents that I feel like are on that addiction path to stress.
There is no doubt. I'll take this back to my firefighting days, that when we'd be sitting around the station just waiting for a good fire, mm-hmm. that is somebody's entire life that is destroyed in a heartbeat. And you're sitting here going, oh yeah, this is going to be great. We're going to kick the door in. We're going to ventilate the roof. We're going to blow the windows out. Or as you said, that with a code or a major trauma, that, oh my gosh, I'm going to get 2 chest tubes. I'm going to get an intubation. I'm going to put a central line in. This is going to be so great. That's somebody's entire life. Now, do I shy away from those? Absolutely not. I will jump in a heartbeat. But now, the difference between when I was going through training and looking forward to all of that and where I'm at today, I will jump in. I have no problem in doing all of those skills. But I balance that with, this is somebody's worst day of their life. Yeah. And I'm not trying to dehumanize them. That goes a long ways towards making that physician-patient relationship. I have some great friends out of the emergency department just from taking the time to get to know them. Mm-hmm. Some farmers in the area. Still to this day, friends 20 years later, that every fall, hey Chris, when you coming out to the farm? We'd love to see you. Haven't seen you, in several months. Just from taking the time to get to know the patient. When you start developing those type of relationships and that type of rapport in the community setting, then all of a sudden it's like, wow, I enjoy going to work. It isn't something that I have to do. I actually enjoy going to work. Mm-hmm. I enjoy the people that I work with. I enjoy my patients most of the time. You will find some that can be a little challenging, and you have to redirect.
Your work setting slightly different than your target audience is right now, but
it might be a little different. I'm not going to disagree with that. So what are some of the things when we're talking about addictive stress? Well, putting yourself in a high-risk environment, trying to maintain that high. Foods, high caffeine. I could drink 2 Blue Monsters and a pot of coffee. Now that I'm older and have gray hair, can't do that anymore. Heart rate gets to 150. Not good. Stressing myself out. But back in the day, I wouldn't think anything of pounding caffeine right and left. Mm-hmm. Just trying to maintain that adrenaline high.
I remember those pallets of Monsters in the garage.
Yeah, Barb won't let me get those anymore. We talked about this a little earlier. Stress from the workplace can manifest itself at home, and stress from home can manifest itself at work. When you come in the door, don't kick the dog. Just because you've had a bad day at work, taking it out on your significant other, they've done nothing to deserve that. Likewise, if you've had a less than pleasant conversation with your significant other, taking it out on your patients or your coworkers, it's not their fault. And once you start realizing that it's not the fact that somebody left the computer frozen and you have a 30-second Tourette spell, or that, oh my gosh, all the out-of-scope covers are missing out of this room. How can this be? And having, again, a total meltdown. Kind of put it in perspective. Cumulative. The straw that breaks the camel's back. The cumulative effect of stress, there are long-term effects that sometimes are not seen for years. As you pointed out with the Holmes Raw scale. And for those that are watching, if you've not had the opportunity, I would encourage you to go online and look up Holmes Raw, Holmes, Raw.
This will be appearing up on your screen about right now, actually.
Perfect. And take this test yourself. Where are you at in this? Because this starts having real life effects on you. From high blood pressure to diabetes to increased risk for stroke, heart attack. It has very real effects. It's important to recognize that. When you start recognizing that, then all right, what can I do to make this better? Mm-hmm. So some of the physiologic responses to stress long-term: coronary artery disease, migraine, headaches, ulcers, high blood pressure, asthma, arthritis, diabetes, cancer, stroke, insomnia, paranoia, decreased ability to concentrate, lower resistance to infection. We used to think that lack of sleep never hurt anyone. That was a joke when I was going through residency. Lack of sleep never killed anyone. Well, they've actually proven that wrong. Mm-hmm. That the longest, to my knowledge, and this is in a sleep deprivation lecture, I think you've even given it. Mm-hmm. I think the longest anyone has ever survived with no sleep was 13 days. Most people start hallucinating at 2 to 3 days. They took a group of Navy SEALs and they had them do fine motor skills. They kept them awake for 24 hours. And these are the best of the best. These are people that have testosterone coming out of their ears. They're young, gung-ho, gonna go at it nonstop. At 24 hours of no sleep, they had them do those same fine motor skills. And their fine motor skills were reduced by roughly 50%. They did a study where they took a group of medical students and they had one group who was post-call, so had been up for 24 hours straight, another group that had great sleep, and they sent them to a bar and said drink, and they made them drink until they were legally intoxicated. They then took the two groups and they had them go through an obstacle course, driving through an obstacle course. The group that was legally intoxicated did better than the group that was sleep deprived.
So the sleep deprived did not drink, and
They did not.
The well slept ones did drink.
That is some of the effects that this has on the body, that it starts impairing you. It can make for an impaired provider. So recognizing that, protecting that sleep, what can I do to make things better? We also, as far as emotions, anxiety, anger, depression, which then can start damaging relationships both at work and at home, leading to even further stressors. So then we get into, all right, what are some of the coping mechanisms that several people have? And some of the ones that have proven not to be effective and actually very harmful: alcohol, smoking, drug addiction, overeating, that you hear stress eating, or I'll just have a couple of drinks, and a couple of drinks starts for the first week, and then the second week then it's a couple more. And by a couple of months they're drinking all that alcohol in order to try to quote unquote reduce their stress. In the end, all they're doing is creating more stress. It is not a stress reliever. Different types of stress: time stress, reaction to a deadline. Imagine going up to, you're going to be getting a new group of residents in, so going up to a brand new intern and saying, okay, I want a white paper on chest pain. I want you to go in detail on the heart score, PERT criteria, thoracic aortic dissection. I want you to build that into the electronic health record so that we capture, and we're going to do a 100% chart on our chest pains. Go. Vapor lock. So set realistic expectations for yourself. To do something like that, which we have built several dot phrases within Epic. We are constantly looking at our risk stratification. We set realistic expectations that we've been doing this long enough that once a quarter we will tackle one or two particular subjects and go in depth to try to improve on those. If you were to try to do that once a week, your stress level is going to go through the roof. You're going to start going down that slippery slope, and it's not going to be as good of a product. Anticipatory stress, fear of future events. You need to have a skill set, and that is where I commend yourself and your other attendings for being academic emergency medicine physicians. Myself, I did not elect to go that route. I wanted to just have my hands right in the dirt. I wanted to get dirty. What you're doing is you're training the future generations, so that anticipatory stress, so that those residents coming out, that they have the knowledge and skill set that I can get through this. Also tailoring this lecture for EMS. So if we're looking at from an EMS perspective, because this lecture will also be going out to several fire departments, that we talked earlier about my fire service days. You wouldn't take somebody who just completed their fire one and have a fully engaged structure fire and say, there you go, there's the 1 3/4, go at it, go have fun. You need to be able to build their confidence level. Get that skill set up, that when all of a sudden it's like, yeah, okay, I got to put a chest tube in, I have to intubate, I have to do the central line. I've got this. No different than the golfer with a 190-yard shot with water and 2 sand traps. They walk up to that shot, and to them it's like, yeah, I got this. Or the classic pianist walking out in front of 5,000 people, and they look out there and go, big smile on their face going, yeah, I've got this. I'd be trembling so bad it would not sound like music. So when you start recognizing if you have that anticipatory stress, then start taking action of getting with a peer or with a mentor of, all right, what are you so afraid of? Are you afraid of the innovation? Are you afraid of running the code? Are you afraid of, and again, going to the fire EMS side of things, are you afraid of that structure fire? Are you afraid of, oh my gosh, I'm going to be on the squad and we're going to get somebody with chest pain? Get yourself with a mentor. Get yourself with somebody who's done this many, many times before, and learn from them. Now, if they're big into smoking, drinking alcohol, using a bunch of profanity, trying to dehumanize people, Find a different mentor.
Yeah.
Situational stress, and that's stress posed by a specific situation. So we have the anticipatory of, oh my gosh, what's going to come in the door next? What alarm's going to drop next? To now it actually comes through. Fire alarm drops. The multiple trauma comes in. The code comes in. You feel responsibility for the outcome of a situation. A saying I used to have with my firefighters was, guys, whoa, slow down. We did not start the fire. We're simply here to put it out. When you have that multiple trauma, or you have that cardiac arrest, you didn't hopefully, you did not cause the accident. You're going to do your best with the training and skill set that you have in order to stabilize that patient and hopefully successfully resuscitate them, or go into the fire side of things. I'm going to do my best to get that fire knocked out and to save as much of the person's personal property that I can. I didn't start the fire. Mm-hmm. I'm simply there to put it out. I didn't create the trauma. I'm simply there to try to help. So don't feel responsible, because you're not going to save everyone out there. It would be great in the ideal world if they came in and it was like Star Trek and I just put my tricor over them and they were instantly better. But unfortunately, in the real world, it doesn't work that way.
Yeah.
Another situational stress is any situation that involves change or uncertainty. I remember when I was traveling throughout the country in the fire service, there was a sign up in front of the Fort Wayne fire stations that basically read 150 years of tradition unimpeded by progress. That people tend to get into a certain situation that they don't like change. People are resistant to change. Change is not necessarily a bad thing. Without change, we wouldn't have the little computer here that we're looking at. We wouldn't have our cell phones. You wouldn't be able to videotape here in your house. So it's being able to adapt. Mm-hmm. Encounter stress. So stress over a meeting or a conversation, conflicts with others, disciplinary action. With my role now, both being a practicing emergency medicine physician as well as an administrator, I would have to say that the administration aspect is, I find, more stressful than practicing emergency medicine. Practicing emergency medicine, I've done it for years. Not saying I've got it all figured out. I'm still learning as I go. But when you get into the situational stress, the encounter stress of having to have a conversation with somebody because their performance is a little low, or having a conversation with a nurse or an off service of, all right, what could we have done to make this better? You'd be surprised how, if you've not done that many, many times, how you can feel your heart rate go up, you're getting sweaty, it's like, oh my gosh. Most people don't like conflict. There's a few out there that I think absolutely love it.
Yeah.
But their Holmes Raw scale is probably 400. Mm-hmm. So talk about sources of stress. Poor relationships, either at work or at home. If you're not happy in those two environments, and I'm going to do a little mathematical equation here to show how the two are actually very similar to one another. That people look at work as just work and home as home. We don't talk about that within our group. We have our work family. It's not where we work, this is our work family. And I'm going to get into the mathematics of that a little bit later. But understanding how one affects the other, that it goes vice versa. So if you start getting a very negative attitude at work, it is a much stronger person than me that can turn that off as soon as they walk in the door at home. Mm-hmm. I can't do it. If I'm having an incredibly bad day at work, I need time to decompress. I can't just walk in the door and it's all gone. Recognizing that, because if you don't, you start bringing that home. That negativity starts following you at home, and you start creating stressors at home because you start creating problems.
Yeah.
And when you recognize that this is my work family, It's not my work environment, it's my work family. And then I have my family here. Both of which are very important to me.
Mm-hmm.
Another source of stress, poor work environment. Noise, threat to safety, poor communication, an erratic schedule that confuses one's biological clock.
I don't know what that is in ER.
Yeah, we wouldn't have a clue. Hate to tell your listeners here, but UPS had done a study several years ago where they took their employees and they segregated. So if you had a smoker, they would put one that worked days, one that worked nights. If you had a diabetic, 1 days, 1 night. High blood pressure, 1 days, 1 night, and so on and so on. And they looked at what was the life expectancy of those who worked days versus those who worked nights. And those who worked nights, on average, lived several years less than those who worked days. So with emergency medicine, with the fire service, you're up all hours of the day and night. You have no control over that. When you're doing emergency medicine, you're rotating through, unless you're lucky enough to have nocturnists, that all they want to do are nights. So you're constantly messing with that biological cycle. So that's where it's important to try to get where you've got some anchor sleep or some protected sleep, and that's a whole nother lecture that goes to that sleep deprivation lecture.
Yeah.
Of recognizing that you have got to protect some time. You've got to start carve some time out for yourself. That is just protected for you, because if you don't, you start going down that scale. You start amplifying the stress. You start getting little baby steps that come into the straw that broke the camel's back.
Just as a real quick, could you touch on the anchor sleep a little bit? That's where you're talking about trying to get a consistent time period that you're getting some sleep, right? Like always trying to be asleep sometime between like midnight and 2, something like that.
Yeah, that's one of the theories on anchor sleep, that you're always trying to get some time period there, exactly as you said, that it's like, okay, my body knows this is when I'm going to be able to get some sleep. The other thing, if you look at the typical sleep cycle, that compared to a 24-hour clock, the body's actually a little bit longer than 24 hours. So if you are going to be changing your schedule, try to always change it going forward. Don't go backwards. Don't start from nights and then go to the afternoons and then go to days.
Yeah.
You go the opposite way, but recognizing that with your cycle, if I go from days and I'm going to sleep at 10 p.m., now I'm working afternoons, so as soon as I get off, now I'm going to try to go to sleep at midnight or 1. And then when I'm working nights and I get off at 7, I'm trying to go to sleep at as close to when I get home as possible, 8. I want to try to keep that cycle where it's moving forward, because if you don't, the lack of sleep starts coming into, and we talked earlier about like with the Navy SEALs and with the medical students.
Yeah.
And it not only affects your performance, it starts affecting your behavior. So just recognizing that, these are things you've got to do to protect yourself. It will pay longevity. It will pay huge dividends, because when you start protecting yourself, you're not quite as grumpy to be around. That's not a bad thing.
Yeah.
The Holmes-Rahe scale, a widely used instrument measuring the level of major life changes an individual has experienced during the past 12 months. Correlations have been established between the score on the scale and serious illness. So some of these scores, if you have a score between 150 and 200, and you maintain that score for months and months and months and months, or years on end, your chance of developing one of the things we talked about earlier, high blood pressure, diabetes, migraine headaches, cancer, down through the entire list, your chances of developing over a decade of keeping your score that high is 37%. If that score jumps between 200 and 300, you have a 51% chance. And if your score is greater than 300, you have a 79% chance of developing one of those serious illnesses.
Yeah.
So the score of greater than 400 for me was a major kick in the teeth of, wow, all right, probably need to do a few lifestyle changes.
Yeah.
We've got to make some changes.
I remember when I doled this out, one of the guys came up to me with tears in his eyes and said, I scored 735.
Oh my Lord.
I was like, I don't even know if you can score that high. Did you score it right? And sure enough, he was the top 15 boxes, every single one.
Wow. You've got to make some lifestyle changes.
Yeah.
You're on a quick road to disaster.
Yeah.
Again, it's not 100%, but you know what? 79%, if I were going to Vegas, I'd take those 79% odds all day long on blackjack or anything else. You give me 79%, I'll go at it.
Yep.
Unfortunately, this 79% is not in your favor.
Yeah.
And remember, it's your perception of the event, not the event itself. So if your significant other asks, hey, can you take the trash out? Something as simple as that. That's a pretty simple question. What did you hear? Did you hear, hey, can I just help and take the trash out? Or did you hear, you're a lazy bum, will you get off your butt and take the trash out? So it's your perception to it, not the task itself. We talked earlier about with the athlete. The body does not recognize the difference between good stress and bad stress. They actually did a study, and they were measuring as far as stress level, and they found it was just as stressful to get married as it was to get divorced. Are you kidding me? Are you serious? The body doesn't recognize the difference between eustress and just bad stress. It's a stressor. Once you start understanding that, so taking that motorcycle and watching those telephone poles go by really fast, taking that sailboat out and flipping it over, rock climbing on places I probably shouldn't have done, and a million other things. To me, that was just being alive. But that was just as harmful to the body as all the other stuff that led up to that. Many researchers believe that the smaller cumulative stressors contribute more to the body's physiologic response than a major life crisis. So having that code that comes in that you weren't able to successfully resuscitate, that's going to bear with you. You'll reflect on it, you'll look at it, and go, okay, what could I have done differently? That's part of just being a good practitioner. When you start recognizing it's all these little things that have the major cumulative effect that starts putting you down a bad pathway that you don't want to go down.
Yeah. That's usually because the little things are there every day, all day, every day. It's constantly adding in versus hopefully we're not having somebody that we lose in a code every day.
Hopefully not.
Yeah.
Hopefully not. We talk about different types of behavior. Type A. Type A's generally are considered competitive, aggressive, deadline-driven. They see other people as obstacles. They're impatient. They're restless. They also tend to burn out.
You could just say me behavior.
That was definitely me. Type B behavior. More patient, cooperative, kinder to themselves. They don't finish it today. There's always tomorrow. When on vacation, they actually relax. This was Barb, when I met Barb. The interesting thing when I was getting this lecture pulled together, I could not find a single study that showed that a type A behavior was more accomplished than type B. And that just made absolutely no sense. It blew my mind. How is it that I'm deadline driven and I'm going to work, and when I'm on vacation, I'm going to do this. And yet, she could be just as accomplished as me. And it's like, maybe there's something to this.
Yeah.
So, kind of coming a little bit more to the fire and EMS side of things, but this is still applicable to your residents. There's growing evidence that show that bureaucratic hassles are becoming the greatest cause of attrition in EMS. It's those little things, as you pointed out. It's not the code. It's not the house fire. It's all the little bureaucratic things that are constantly being thrown in your face.
Yeah.
Today the sky is red, tomorrow it's purple, the next day it's green. This is changing, we're doing this, we're doing this, we're doing this. That has found in the fire and EMS side of things to be one of the leading causes of attrition. Yeah. You have lack of uncertainty, no control over a day's work. That's true whether we're in the fire service or in the ER. I have no idea what the day's going to bring. It could be oh my gosh, we're not going to eat lunch today, to, wow, I was able to go online and do some shopping on eBay. And it can be anywhere in between. And that's, to me, further on in my career, that's part of the beauty of it. I don't know what the day is going to bring. So I walk into the day of, it's a new day. Let's see what it has in store. I have no anticipation of what's going to happen. I'm just going to take it as it comes.
Yeah.
Physical response to the alarm. Again, we talked about this earlier. It can take several hours for the body to return to normal, even when the alarm is off. So when the alarm is finally all taken care of, recognize that you're still amped up. Recognize that in yourself, so that you're not biting at your coworkers.
Oh yeah, you think about that when you're on night float and the pager goes off. It takes you a good 10 minutes to try relaxing back down after giving Benadryl for the 40th time.
Absolutely. Interpersonal tension, crisis nature of being in the fire EMS world or being in the medical world. It often magnifies the tension between peoples or organizations, that we're in a high stress environment. That's the life we chose. So recognize that, embrace it. Don't sit here and let it be a negative. Again, it's your perception to the task, not the task. Mm-hmm. Exposure to human tragedy. A typical day in the fire EMS or ER world, for most people, if you took them off the street and said, here you go, you got a little child breathing 50 times a minute, turning blue, go. They vapor lock. No different than if you put a piano on a stage in front of a bunch of people and said, okay, Chris, go. I don't know how to read music. I don't know how to play any instruments. Nope, mm-hmm. I'm staying off stage. Many people, and I found this to be more true when I first started in the fire service. I still find it a little bit true in the medical world, that they believe they have to portray a macho image, that you were weak if you came back from a run and you tried to talk to other people about it. That after a bad run, you'd have 6-7 guys out on the apparatus floor, and that's back when you could smoke in the station. Half of them would be smoking, half wouldn't, all just kind of milling around, not really saying anything to anyone else or each other, because that's just what you did. You didn't talk about that. Mm-hmm. Your grandpa went through that. And let's talk about the negative stressors. What'd he do? He turned to alcohol. And that in and of itself created more stressors for him. That there's no place for machoism in this world. Whether we're in the fire service, in the medical community, you don't want to be sitting there your entire day talking about your feelings. Otherwise, you go into psychiatry. But it's important that if you're having something that is really eating at you, that you have that peer or you have that person that you strive to be. Talk to them. Mm-hmm. How do you help get through this? How do I navigate my way through this?
Yeah. And like for us at UT at least, we've all got access and have given it to all the residents. Like we have counseling available through the university, and so that's something that is available to you guys watching, at least from UT. That's a very important thing. You can reach out and have that, no questions asked.
And for the firefighters out there that are watching this video, I still do some fire and EMS. We have several medical directors within our group. We're always available. Mm-hmm. Give us a call. I may not be able to talk right away, especially if I'm on duty, but we'll try to work with that. Yeah. So what can we do? Because all we've done so far is talked about the gloom of, oh my gosh, why in the world did I go into ER? Why did I choose to be a firefighter or a paramedic? What in the world did I get myself into? So we've talked about the bad things. Now let's talk about some of the good things. Exercise. Mm-hmm. Exercise programs actually help to reduce that physiologic response. They burn off some of that extra glucose that's floating in your system. They actually help to lower the adrenaline level. So this doesn't have to be I'm in the gym for 3 hours a day. This came out of Southeast Asia when they were looking at this. It can be 15 to 20 minutes of exercise. And it doesn't even have to be sustained. You could do 10 minutes here, 10 minutes here of a cardiovascular exercise. Just something where you're getting the body moving and getting that physiologic response to lower the internal stress level. Nutrition. Try to avoid high carbohydrate diets, caffeine, alcohol, and tobacco. Those are not your friends. So high carbs, eating the Snickers bar day in and day out. Caffeine, the case of Blue Monsters. The alcohol or tobacco are not your friends. Mm-hmm. They keep that stress level up. try to avoid those type of foods. Schedule your meetings. Meet regularly to discuss problems. Set realistic expectations for yourself and your team. Don't sit here and think that you're going to take on the top 10 ER encounters and you're going to create risk stratification for all 10 of them in a month. It is not going to happen.
Yeah.
Or don't expect as an intern to, at the end of your first year, be as proficient as the attending who's been out for 10, 15 years. Not going to happen. Same when it comes to being a firefighter or a paramedic. Just because you've been through your 200 hour, you have your firefighter 1 and 2 card, you don't have all the answers yet. So be realistic on this. Provide training. That's what we're doing here. Mm-hmm. That's what you do in your daily world, being an academic emergency medicine physician. Increasing the confidence and performance of those around you, so that when they do have to get that innovation, for the firefighters out there, when I have to attack that fire, I've got to charge the line, breach the door, get the ventilation set, I've got the confidence I'm going to be able to get this. Mm-hmm. Just like the golfer who can nail that 190-yard shot. Encourage counseling when needed. The use of a professional counselor should never be looked at as a sign of weakness. When you're going to a peer or a mentor of, hey, I had a situation, how do I deal with this? That's not a weakness. That's a strength. I would have to guess on this, I don't think there's anybody who's been practicing emergency medicine long enough that doesn't have their own skeletons, mm-hmm. their own demons. So if you talk to somebody who's been through this before, I can just about promise you that they felt the same things that you're feeling. And all right, how do I navigate this? How do I help decompress this? How do I help? And explaining this to your significant other, that if you had a bad day at work, without getting into HIPAA, any violations, just that I've had a bad day at work. Barb knows when I walk in the door. If I'm real quiet, I walk over, I grab the dogs, I just need to decompress. So she just lets me decompress. And those 2 little furry creatures sitting there, listening to them whine and wiggle their tails and everything, about 4 or 5 minutes of that, and I can just feel the stress start to melt away. I don't have to hop on the motorcycle and make the telephone poles go by really fast. Incident evaluation. Looking at the incident and talking about what could we have done better. Analyzing it so that the next time that situation occurs, it's like, okay, yeah, we've thought about this. This is how we're going to go through this. So that I'm on my A game when that high stress situation finally presents itself again, because it will.
Yeah.
So there are 3 primary strategies in dealing with stress. You can change or avoid the stressful situation. Now, it's a little hard. I can't say, sorry, you're having a heart attack. Not doing it today. Not going to do the resuscitation. Not on my list. Not going to intubate you. Not going to happen. I can't do that. That is not an option. So I can't avoid the stressful situation. What I can do is I can start to refuse to accept more than you can handle. So when you're asked to make your 15th meeting of the week, it's okay to go, no. Nope, I'm sorry. I'm already, that's protected time. I already have something else planned. Can't do it. So recognize the limitations. Take proactive stances instead of a passive one. Communicate. Seek information. Make your needs known. Mm-hmm. If you're having some difficulty, make your needs known. Change your perception of the situation. Instead of letting fear of failure dominate your thoughts, emphasize the opportunity that's there. I have an opportunity on that cardiac arrest to get a resuscitation. When a cardiac arrest walks in the door, my mindset is they're already gone. That's my mindset when I walk in.
Yep.
Now I'm going to do everything possible to prove myself wrong. And if I'm successful, I proved my initial mindset wrong. But when that cardiac arrest, that EMS has done everything they can, when it walks in the door, they're already gone. And now I'm going to try to prove myself wrong. Mm-hmm. It's the perception thing. Whereas if I walk in, oh my gosh, I'm going to save them, and then you don't save them, what'd I do wrong? And you start wearing out badge, that baggage,
Yeah.
and it's not a good thing. You can accept the fact that you're not perfect, accept your limitations in an overwhelming situation. Look at your problems not as problems, but as challenges. Okay, throw it at me. It's the only way I'm going to get better. Whereas if I look at it as a problem, now I'm trying to avoid it.
Mm-hmm.
I'm not going to avoid it. Never did that as a firefighter. I'm not going to do it in medicine. So throw a situation at me. Let's try to find a way to get through this.
Yeah.
Increase your ability to cope with the stressful situation. What is the absolute worst thing that can happen? And if it does, what options do you have? So in that cardiac arrest, the absolute worst thing that can happen is when I go in with the mindset that they're already gone and I'm going to try to prove myself wrong. Well, I don't prove myself wrong. I went through, we've secured the airway, we've went through all the ACLS medications, we have done CPR, now with ECMO on the scene, we even did ECMO, and we're not going to get a successful outcome.
Mm-hmm.
I did everything I can. So in my mindset, myself, I look at that I did everything I could. Bad things happen to good people. Unfortunately, that is the job that we have chosen, and for your audience has also chosen.
Yeah.
You can also help your body through what we talked earlier with exercise, diet, meditation. I actually read books for fun now. I have several authors that I follow that as soon as a new one hits the shelf, I'm downloading it on my Kindle. I never did that before.
No, you didn't.
Not at all. I despised reading. So our amplifiers, kind of going through this, again, for the audience here, caffeine, sugar, alcohol, tobacco, overeating, those are not good. Avoid them. You have got to get them out of your daily life. Excessive caffeine, excessive eating, sugar, the high carbohydrates, the alcohol, tobacco, they're not your friend.
Mm-hmm.
Other types of stress amplifiers, few or no rest periods. So it's just go, 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 go. You start reaching a point when you're driving that hard, and that comes that type A, type B behavior, that it's counterproductive. You're actually wasting more time than the type B who sits there and gets a little bit of rest, comes back refreshed, looks at it a different way. It's the project Barb and I are doing up at the condo right now, that I'm just in there bending nails and going at it, and she comes down and looks and goes, what about this? And I sit back and look and go, it's a pretty good idea. I don't know how I didn't see it. Well, how I didn't see it is I'm go, 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 go. Mm-hmm. She's coming in with a fresh perspective, fresh attitude, and it's like, oh my gosh, how could I have missed that? Has only one or two interests. Have varied interest. Mm-hmm. Your life shouldn't just be about work. You've got a family or hopefully a support network. You should have other interests. Getting out exercising, golfing, boating, jet ski, out on the motorcycle, biking, now with nature, getting into cameras. And by the way, do not buy the most expensive camera on the market because it doesn't have an idiot button. That's a high stress thing. You're sitting here going, how in the world do you do this silly thing? It does not work. Little sense of humor, not letting go. You need to be able to roll with things. Mm-hmm. If you carry them with you, that baggage will start catching up.
Yep.
Chronic struggle with time, attempt too much. They take on project after project after project. Just, again, not being able to say no. Of recognizing, get through one thing before you go to the next. It's one of the philosophies that we took within our group. Pick one thing and do it well. With us, we strived on patient engagement with risk stratification. Those were the things that we wanted to strive on. Have no interest in creating our own billing company, creating a whole new EHR, or any of the other stuff. So be careful if you try to diversify too much as far as what you're going into for work. Mm-hmm. It would be like trying to be triple boarded. You want to be an ER doctor, an anesthesiologist, and a pulmonologist. What do you want to do? So pick something and do it well. too busy for self-improvement. When you're so busy that you can't do the things that we talked about earlier, as far as just a little bit of exercise, the meditation, grabbing a book, going outside, watching the hummingbird build the nest. When you're so busy you can't do that, you've kind of lost sight of this journey. Because it is a journey, it's not a destination. Mm-hmm. You only have one shot through this journey. And if your sight, if your focus is solely on the destination, you've missed the most wonderful part of it, which is the journey. It's like getting to someplace. If you're driving across country, you're driving down to Florida. If you're so focused on, I got to get from here to here, you miss some of the scenery of going through the Smokies or pulling off on the roadside rest and the little shops and stuff. Oh my gosh, there's so much wonderful things to see. But if the only thing you can see is getting your destination, you missed everything in between. When you set yourself up for that, and this kind of comes with my career very early on as a firefighter. When I first started in the fire service, I thought to myself that if I could just get promoted to an officer, I'd have the cat in the bag. Well, I got promoted, and my life was not complete. So then the thought was, if I just get that next promotion, then I'll be all set. Didn't happen. Took promotion up to the rank of deputy chief. At deputy chief, I was being groomed to eventually become the chief. It was a psychological profiler that sat me down after a 2-day psych test and recommended that I leave the fire service and go into medicine. I'd never considered medicine before then. I was a firefighter through and through. It's what I did. It's what my father did. It's what my grandfathers did. That's, by God, what I was going to do. I was so focused on the destination that I lost sight of some of the journey along the way. That type A behavior. And you can get into this in medicine as well. If you're so focused on getting through residency, getting board certified, you're missing some of the greatness that this journey has to offer.
Yeah. Residency sucks, but there can be a lot of good memories had within it too.
There can. There absolutely can. I mean, it's going to be hard work. If it were easy, everyone would do it. Mm-hmm. But keeping your eye on the prize and enjoying the journey each and every day. Because if your only happiness comes from reaching that final day, it's a miserable 3 years.
Yeah.
Or as a firefighter, if your only happiness comes to when you make the drop, it's a long 25 years. Enjoy the journey. Mm-hmm. Always in overdrive. Work is often at odds with personal values. When it's always work, and you don't have any time for your family at home, you start creating those stressors at home that we talked earlier, how that comes back into stressors at work. Mm-hmm. And it becomes a cycle.
Yeah.
Not a good cycle. No regular sustained exercise, no recreational activities outside of work. We've all met individuals like that is their entire life. And you see those individuals after they retire, within a couple of years, they've either passed because they have no drive, or they're making everybody around them nuts. So have some hobbies outside of work. Mm-hmm. Have some things that it's not all about just work. Some other stress amplifiers holds in emotions. So that macho attitude.
Yeah.
It's not good. It's not good. Generally, when you have something like that, it can set up for, if we start down the cycle, that you start getting low self-esteem. So you may think that initially it's like, oh, look at me, I'm so big and bad. It actually has the counter effect long term. You start becoming rigid resistance to change, competitive, or an underlying hostility.
Yeah.
With your fellow firefighters or your fellow residents out there, that's your work family. Notice I said work family. That's your family at work. Start looking at them as family.
Yeah.
Because again, we're going to get into shortly here that mathematical formula where I'm going to show why it is your family.
Yeah. Now, to be clear, though, there's nothing wrong with being competitive, but there's a difference between being competitive of I will push you down so I look better versus I'm going to do better to make you do better.
Oh, absolutely.
And that's the competition that we want.
Absolutely. It's fun when you're in a really busy environment of, all right, we're going patient for patient. Here we go, boom, 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 boom. But exactly, when you're trying to make the other person look bad, you've completely lost sight. You have completely lost sight of what this journey's about. Because when we start working together and we're encouraging each other, we get that symbiotic, that cumulative effect going the other way. We actually make each other better. Versus when I'm trying to push somebody down, does not work so well. Creates that negative downhill slide. So some relaxation techniques. Postpone thinking about problems when you're overwhelmed or distressed. Give yourself a break until it's more appropriate to deal with the problem. I have a rule when I'm really upset. I will take 24 hours before I respond. If I'm thoroughly upset, it might be 2 days to kind of get a different perspective, look at this from every angle. If I'm feeling overwhelmed, that's not the time to be making a major business decision.
Yeah.
Not good.
Yeah. There's something to be said with that too. Like it sounds so trivial to give yourself a break until it's more appropriate. Not just thinking that, but actually verbalizing it out to yourself. Like I found that in my own life when I was in med school, borderline failing some classes, and then finally said, I am giving myself permission to take Sundays off or Saturdays off or 1 day a week off. Just having that verbal permission given to myself, all my grades shifted. I went from borderline failing to almost never missing a question on the quiz without studying, without pushing myself even harder, just from that break and that actual, this is my time to not think about stressors X, Y, and Z. And I think that's a really important step that a lot of people will miss. They think they're taking a break, but they're still, I'm golfing, but I'm actually thinking about work. No, just give yourself permission to have that 4 hours off.
I couldn't agree more. Could not agree more. I think they've actually even done studies when it comes to studying. And this may have changed. The last time I looked at this, they said that for the average person, about 45 to 50 minutes, and you need a break. You've got to take a break. To sit there and just keep cramming hour after hour after hour after hour. Pretty soon, it was like you saw some of my books. I pretty much highlighted every single word. That's where I could tell where I was at on the page. How much of that retained? Enough to pass.
Yeah, -3% for me.
Yeah, exactly. So taking that time of recognizing that, all right, yes, that is very well said. So get realistic about perfection and build in margins of reality to account for failures, because they are going to happen. Nobody's perfect out there. Contact a friend, talk, vent, have lunch. Wear clothes that make you feel comfortable outside of work. If you're at work, you got to have work appropriate clothing.
Scrubs are good.
Scrubs are good. Take a walk instead of a coffee break when you're just feeling like, oh my gosh, okay, heading for that 6th cup of coffee. Just take a little walk. Go up and down the steps. Just clear the mind. And when you come back, it's amazing how your perception starts to change. Sleep enough for yourself. That's a whole nother lecture for another day.
Yeah.
But incredibly important. Look at the UPS study. You're taking years off your life if you don't do this. You've got to have protected time for yourself. Don't take yourself or your skills too seriously. You're a part of a team. You're not perfect. You're going to do your best. When you start taking yourself so seriously, you have no margin for error. And other people will start looking at you, oh my gosh, and you start down that downhill slide. Maintain a sense of humor. Be able to laugh at yourself. If you can't laugh at yourself, you can't laugh at anyone. try to maintain that sense of humor. And I know that's hard in certain situations. Mm-hmm. When you get through that, all of a sudden it's like, this isn't so bad. Do something you've always wanted to do. That, oh my gosh, I think I would like to take a bike ride from Port Clinton to Bowling Green, since we have places in both. Do something you've always wanted to do.
Yeah.
Finish a task on the to-do list. You'd be surprised. There was a period of time that now with my phone, I can just put it on my phone, but I would write down on a piece of paper my to-do list. And I can actually, when I crossed one off the list, how that made me feel. Mm-hmm. Wow, that's off the list. Join a group outside of work. Finding those other hobbies. Be at church. Mm-hmm. Golf. Which, by the way, when I see a 190-yard shot, I see water and sand. I don't see a 5-foot area on the green.
I'm looking for people on the other holes because I know I'm going to hit one of them. I'm not paying attention to the green.
Meditation with yoga, Tai Chi. Just something to clear the mind, as you said, where you took those 4 hours where you're like, look, I'm giving myself permission. It's meditation to be able to clear the mind. Mm-hmm. Read a novel. David Baldassi, one of my authors that I'm really into right now. There are several authors that, again, I follow that it's like, oh my gosh, I enjoy getting home and firing up the hot tub, getting the Kindle out and sitting there and reading a couple chapters. I can just get lost in that for a half hour, 45 minutes. And it's like, wow, I can't believe, where'd the time go? You feel so good getting out of there, where it just helps decompress everything. And listen to music, find an enjoyable hobby, take a mini vacation. It's okay. Say, hey, you know what? Let's head up into Michigan. Let's go visit the lakes. Mm-hmm. Let's head out to the islands, out at Lake Erie. It's okay. You don't have to go 365 days out of the year. It's okay to take time for yourself. Go to the movies, a theater, a concert, or a sporting event. Do something fun with your significant other, no less than twice a month, to reconnect with them. Yep. They're an important part of your life. Do something fun with your kids. Try to do family activities at least weekly. Create and negotiate for win-win situations whenever possible. And when appropriate, allow yourself to cry. Mm-hmm. Be able to laugh at yourself and recognize that, yes, we are all human. We all will stumble. I love this one on the list. Buy yourself a gift for no specific reason. I use that one a lot with Barb. That it's like, yep, I'm feeling a little stressed. I think I need to buy myself a gift. She thinks I put that in there on purpose. I actually pulled that off the internet on relaxation techniques. Don't abuse any substances. Learn how and when to say no. Recognize your limitations. Avoid workaholism. It's nothing more than escape. Mm-hmm. Your grandmother. She worked 3 different jobs her entire life right up until when she passed away from leukemia. That was her life. That is all she knew how to do, was just work, 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 work. But it allowed her, in my opinion, to avoid some of the situations at home with Charlie, mm-hmm. with his drinking. Because if she was at work, she didn't have the confrontation then. Yeah. So don't be a workaholic. Guilt is an emotional baggage. Let go of it. Guard what you say about your past. Don't confide in people you don't trust. Anticipate those stressful situations and prepare for them. Anticipate that, yes, that next major trauma is going to come in, that cardiac arrest, or that fire alarm is going to drop. Mm-hmm. And what am I going to do? Have your game plan already set. That's what an athlete does.
One of the things I say to the third years that are moonlighting or graduating is walk yourself around the ER, know where everything is in the new rooms, because we're so used to Toledo Hospital, Flower Hospital, or UT, where they're at. When you're at your new place, learn where everything is in that resus bay, because all of a sudden we don't know where it is. It gets a lot more stressful, but if you have a general idea, like, okay, here's where the vent wall is, here's where the supplies are, here's where this is, it helps you in that preparation stage for when something that is coming in.
Oh, absolutely. And kind of a final closing point on this portion of the series. Remember, if you don't take care of yourself, how are you supposed to take care of your patients? Mm-hmm. Because if you start down that slope, if you start going down that road where you're getting that negativity, it's really hard to deliver a great quality experience for your patient when you're negative yourself. Yeah. And when you're negative yourself, remember, that starts carrying over into the home environment. It takes a really strong person to be able to turn that on and off. I've not met very many. Mm-hmm. So when you're starting to get so negative here, it starts creating negativity here. Yep. All right, so we actually developed this in anticipation of opening up our freestandings in Perrysburg, Pennsylvania, mm-hmm. that we had a chance to establish our work family, talking about culture and the teamwork that goes with it. So just like before, first thing I like to do is look at what is the definition of culture. What is culture? Culture is an attitude, feeling, value, behavior that characterizes society as a whole or any social group within it. Okay. So we bring that into our work family, and it's the attitudes, feelings, values, behaviors that characterize that work environment. Be that in an emergency department, be it in a hospital system, being in a fire department. Mm-hmm. That each entity has its own little culture. And you'll notice that when you go from location to location, you feel little differences. Mm-hmm. There's little subtle differences in between all of those. Each one has its own culture. So how do we establish if we're looking at success? So we talked about some of the things when we talked about stress, as far as exercise and food and meditation and doing things for yourself. When we start looking at culture and success, there are 3 words that come into mind, and I'd like to do a little alphabet game. So what I'd like everybody to do is just make the alphabet out, A, B, C, D, E, F, G, all the way to Z. And then below the letter A, start with 1, 2, 3, 4, 5, all the way up to 26. So 3 words that come into mind when we're talking about success. First is knowledge. So spell out the word knowledge. And I want you to put the letter that corresponds with the number.
11.
I'll help you.
14.
There you go.
15, 23, 11, 12, 5, 4, 7, and 5.
And when we add those all together, we get a correlation of 96%. So 96% correlation between knowledge and success. Without knowledge, it's hard to enter the game if you don't know the rules. Mm-hmm. So you have to have some knowledge. But knowledge alone doesn't do it. Yep. So let's do hard work. 98% correlation between hard work and success. Now, let's go to attitude. Attitude, 100. Now, I know that's a little mathematical game, but that applies in real life as well. Kind of like we talked about, it's not the event itself, it's the perception of it. When we're talking about going into a work environment, whether that's the fire station, whether that's residency, whether that's at somebody just graduating and entering a new group, mm-hmm. It's not the task itself, it's not the event itself, it's your perception. When you go in with your attitude, has more of a bearing on how this is going to play out than any event itself. If you go in with a very low expectation, I can guarantee you're going to hit your target. Those who go in with a very negative attitude generally hit their target. Your attitude, just like when we talked about stress, and not the event itself, but your perception of it, it's your attitude. So when we're talking about attitude, you can alter your life by altering your attitude. I've got a t-shirt that I wear all the time. It says, life is good. It is. Life is good. I've got 2 great kids. I've got 2 wonderful grandkids. Barbara and I have more than I ever could have dreamed of. Growing up as a small country boy outside of Defiance, never would have dreamed that we're at where we are today.
Mm-hmm.
What is to be so miserable about? There isn't. We've got a great life. That's the attitude and the mindset of going into. No different than going into work. I've got a great work family that I work with. I work with great peers. I have good administrators that I work with. It's a lot of fun. Got an administrator from Wisconsin coming down. Tom Arquila, you remember Tom? He's coming down from Wisconsin. He's here right now. We're going to have dinner here in a couple of days. Lifelong friendships that I wouldn't trade that for the world. And again, that comes into your attitude of where do you set your expectations. It has been said that life is 10% of what happens to you and 90% of how you react to it. And I wholeheartedly agree with that.
Yeah.
It's not the event itself, it's your perception of it. I used to have a saying with my firefighters that imagine the taxpayers driving by the station and you got 5 or 6 firefighters out front and they look over and go, are you serious? Look at those. I don't believe them. I work 50 hours a week paying taxes so they can be out there grilling steaks, just having fun on my tax dollars. 2 days later, that same taxpayer's house catches on fire. Firefighters show up, put the fire out, rescue the family pets, save a bunch of the wedding photos, protect the house, help clean everything up. A week later, that taxpayer drives by the same fire station, same firefighters out front, blowing the horn, waving, going, oh my gosh, they're heroes. They deserve a raise for all they did. I can't believe they put their life in harm's way to be able to save my family dog. What changed? Same firefighters, same station. The only thing that changed was the perception. That was the only thing. So it is truly, life is 10% of what is thrown at you. There are some things that are just outside of your control. You're diagnosed with stage 4 pancreatic cancer. Life's not going to be very good for long. Mm-hmm. There are some things that are outside of our control. But for the 90% that it's in your control, it's your attitude. Do you have an attitude that's worth being contagious? Or do you have one that you're so negative that you're bringing everybody else down? Because if you have that negative attitude at work, just like we talked earlier, you start taking that home.
Yeah.
And is that really what you want to do, is bring your significant other down too? Do you want to bring everybody down to your level, or do you want to start changing your own attitude? Everything starts with an attitude. How you get up in the morning determines how your day's going to go. Hey, it's another great day. Let's see what it has to offer. Or is it like, oh my gosh, I can't believe I got to do this today? Because again, if you set your expectation low, you're going to hit your target. Hardening of one's attitude is generally considered the deadliest disease on the face of the earth. When you start getting that negativity, you start pulling other people down with you. Again, is your attitude worth catching? Before you can change your thinking, you have to change what goes in your mind. The happiest people that I've met don't necessarily have the best of everything. Mm-hmm. I look at some of my neighbors up in Port Clinton. The vehicles they drive are worth more than my property. And I just sit back and go, okay, sure. I am quite comfortable with everything I have. I think they've even made songs about that. The happiest people don't have to have the best of everything. Mm-hmm. They make the best of everything. Enjoy what you have. Don't be trying to compete with the Joneses and always, oh, if I only made more money, just like me as a firefighter, if I just got the next promotion, you're setting yourself up for failure. Mm-hmm. Clear your mind of can't. Just drop the T, because all it stands for is trouble. I can do this. We'll get through this. We'll go okay. God chooses what we go through. We chose how we go through it. So there are going to be things thrown at you you have no control over, but you do have control of how you go through it. If you want a certain quality, act as if you already have it. One of the best ways we influence others is by our own actions. Who we are speaks much more loudly than what we say. Lead by example. Goodness is about character. Character is about integrity, honesty, kindness, generosity, and moral courage. More than anything else, it is about how we treat other people. Mm-hmm. How do you treat your coworkers? How do you treat your family, be that work family or home family? Again, do you have an attitude that's worth being contagious? Or are you the Debbie Downer? So, kind of finishing this up, and you've heard me talk about that work family and home family. And when we were creating this lecture, I did a little mathematics for myself. So I'll pick on myself. I won't throw you in this one. And started looking at, all right, this is, and again, it all boils down to attitude with where I'm at, what I'm doing. So I look at time spent as a physician. When I created this lecture, it was roughly 42 hours a week that I was putting in as far as clinical time. Time spent with administrative duties, that added about another 10 hours a week. Now, because our group covers ERs throughout Northwest Ohio, some of those are an hour drive there, hour drive back, plus other drive time. My time spent driving, going to administrative meetings, going to my clinical shifts was about 14 hours a week. At that point, I was sleeping about 6 hours a day, or another 42 hours a week. Time spent shopping, errands, exercise, is about an hour a day when I pulled this lecture together. So that was about another 7 hours a week. I would say now with summer here, I'm getting out doing a lot more things. That number's probably actually closer to 15 hours a week that I'm spending with exercise, just going out and doing things. Mm-hmm. So when I did this presentation, the total of my above hours, if you add up the 42, the 10, the 14, the 6, the 7, which again is on the low side compared to summer, as at 115 hours a week. I have 24 hours a day, times 7 days a week. It's 168 hours in the week. So let's do the math here. And I have 168 hours. I take 115 hours of those away because it's simple math. This is simple 1 plus 1. That leaves me 53 hours a week at the place that I call home. But yet, when I start looking at what I spend as a physician in my administrative duties, I'm at 52 hours a week. That's not even counting my prep time, getting ready for a meeting or getting ready for a lecture, like trying to set this up with yourself. Mm-hmm. So that's not even counting any of that. I'm spending as much time at work as what I do home. I spend an equal amount of time. For some, they spend more time at work than they do at home. So why would I not? I guess to me that's the bigger question coming into attitude and perception. Why would I not consider this my work family? Because I'm spending as much time here as I do here. And when you start looking at it from that perspective, perception is reality. When I start with that perception of, wow, this is pretty important. And if I allow this to be negative and is equaling as much, if not more time than here, how long before you think it starts dragging this down?
Yeah.
Only a matter of time. Sorry about that.
Speaking of work and home life.
No, it's actually one of my ski buddies. Is Jim.
Oh.
I haven't talked to him in a couple of months because it's not ski season yet. Talking about hobbies and stuff.
Yeah.
So, again, perception, attitude. There are things you can do to start improving your overall demeanor. There are things you can avoid to help from pulling yourself down. And when you recognize that both of these places, work, home, are important, and why? Because it is a circle. And if you have an incredibly negative attitude at one, it will come into play here.
Yeah.
And then you'll start getting a feedback. Break that feedback. enjoy the journey. You have one shot at this journey. Enjoy it. And there's going to be times, I will not even try to argue otherwise, with residency that you're just like, oh my gosh, really, are you serious? You have duty restriction hours now. You remember when peds ICU and neurosurgery, we averaged about 120 hours a week when we were on those services as residents. We didn't have the duty service hours then. That Barb would actually come up and try to see me at the hospital because I could hardly ever get home. And when she would get there, we would go to at least get dinner together, and she'd walk into the hospital, and within minutes of pagers going off. It's like, I gotta go. I'm sorry, I gotta go. That's not fun.
Mm-hmm.
I will be the first to admit that. But if I allow that to start corrupting my attitude and start making me a negative person, that negativity will flow over to this side. And it's not a cycle I would choose to get into.
Yeah. Yeah.
Anything else I can add?
I mean, yeah, just like you talking about that, it brings to mind all the stats with marriage and emergency medicine in particular. It's, gosh, what is it, almost 70% of ER marriages end in divorce?
Yeah, I try not to look at that stat.
Yeah,
I'm very happy with where I'm at.
No, me too. Me too. But and you see how quickly it can become toxic. Like it's the highest stress, one of the highest stress jobs in the world. Like that and air traffic controlling, I think, have always been the top two. And you see how just quickly that can toxify work life, and then it comes around to home life. And it's something that I think, you know, as firefighters, as residents, it's something that we need to deal with now while it's early. Me having young children, we're reading about how to discipline them. The best time to start disciplining your children is when they're younger, when they're first learning how to do things, because then it sets the expectation of what's to come. And if we start in our careers early on saying, this will not affect my home life, or my home life will not affect my work life, it gives you that better balance, that better safety to either insulate the two away from each other, or to ensure that there's no negative feedback loop that just constantly feeds forward into itself. So I agree with you what you've been saying about this. If we could take this and, I mean, shoot, just off the cuff, I could talk for hours on this too. But I think that's a great thing to kind of get in the mindset early of really taking control of work and home, and ensuring that you have the best possible attitude. Yes, bad things happen, like you were saying, but trying to be the better person through it. What can you glean from it that will make you improve? I think that's the takeaway that I'm getting from this, of in all things try to be positive. When you can't, take it as constructive.
Well, and recognize those things that you can do to maybe make life a little better.
Yeah. Yeah, I think the thing that I took when I was a resident is we're all suffering equally. Why not make it an easier trip for everybody? Like, if you can go out of your way to make things more positive, why not do it? Easy to complain, far harder to do things well for another person.
Absolutely.